My name is Bob Brocker. I'm the founder and president of this organization called AgeWise Colorado, and Barbara Boyer is our executive director. So, hey, Barbara. So we are AgeWise Colorado, as I mentioned before, serving the aging Coloradans and the caregivers of today and tomorrow. So it's very appropriate for the topic for today. And today this is our 48th educational webinar since we launched AgeWise Colorado in July of 2021. So today we're talking about in-home care, both medical, non-medical, and who pays for in-home care, and what about some veterans benefits that might be associated with in-home care for vets. Today's panelists, which I will introduce briefly right here, right now, and then we'll come back in just a second. So first is Rick Seek, who's the CEO and owner of Home Helpers of Metro Denver, and Rick will be speaking first. So Rick provided this, saying that not only the valuable service of bringing one-on-one care to our seniors and individuals recovering from surgery, rehab, and others with continuing care needs, but is also a leading employer of some amazing women and men who truly make a difference in lives that they touch. In-home care allows Rick and his team the opportunity to be active contributors in communities and homes throughout the Denver metro area. And next up, after Rick, is Seth Palmer, who is the marketing coordinator for Bright Star Care for Central Denver. He's a community liaison on behalf of Bright Star Care Denver metro area. Our mission at AgeWise Colorado is simply to connect at no cost all older Coloradans and their families to reliable, helpful services, products, information, assistance, and education to help the over 3 million aged 40 plus Coloradans along on their aging journey to age well and age wisely. So this is our little point here. We are connecting those 3 million to roughly 3,000 service providers, that we think exist in the state of Colorado who have something to do with aging. This is just a snapshot of our homepage on our website. If you haven't been on the website yet, we encourage you to do that. And then finally, we have a couple of webinars coming up in May to be aware of. That would be, first one is wills, distress, trusts, and estate planning. We have a couple of attorneys who are going to be talking about that. And then later in May, a lot of people over the age of 50 are looking for work, whether it's paid or unpaid. And so we're going to be talking with some folks who are focused on that very topic. And then finally, this is our board of directors, which I will just flash up here briefly. So it's part of the recording, and same thing for our longer bios for both of our speakers for today. So with that, I am going to stop sharing and ask Rick, as our first speaker, to talk about what he's doing and what Home Helpers is up to. So take it away, Rick.
Thanks, Bob. Appreciate you asking me and Seth to be here today. Seth, I love having you're a younger guy than me, and I love it because it's you that are going to be taking this forward. I started out in home care in the mid '90s. I joke around. I tell people I'm not only the owner, I will someday soon maybe be the client. Because it's happening quickly with the aging population. Back in the mid '90s, late '90s, even when I started with the agency, we probably had about 44 million seniors, and that would have been at the time still what they considered 65 years old and older. So that's 25 years ago since 1999, and we're roughly around 58 million seniors in America. What's going to happen and why this meeting is so important, this webinar, in the next 7 years, by 2030, we're going to increase to 77 million seniors. So what's taken 25 years to happen in the USA is going to happen again in the next 7 years. So with that, companies like Bright Star and Home Helpers, Home Care, there's an intensity right now. They've always talked about the tsunami. I don't think it had hit. We feel like it has, but what's about to hit is the real tsunami. So here at Home Helpers, we've been open since 2008, so I guess 16 years now. I'm actively involved day to day with my team, my caregivers. Uh, we have similar issues. Pardon me with that phone there. We have similar issues that all agencies are having, and that's finding great caregivers, not only finding the talent and people that have that caring heart, but retaining them. So, right now, the lay of the land with home helpers, we're trying to find those people. I've got a couple of folks that one's a nurse, one's a medical assistant. They do all my hiring and training. Um, Probably the next thing that I'm seeing more and more of with this population, we're having a lot more health issues come up. Some of it's heart disease, cancer. Those tend to be the two, number one and two. I'm also seeing an uprise in clientele that are living with Alzheimer's and dementia. So, as an agency, that means we've got to continue our training and bringing in people that, they're not only going to be great at the care they give, but there's a psychology to it. And really, we're helping our families take a step at a time. So, right now in Denver, there's probably Seth, when he gets on, he may have better numbers. There's probably a couple hundred agencies. We have a lot of private caregivers. I know Bob asked me to touch on how do people pay for services. So here at Home Helpers, we're seeing, of course, a lot of it's private pay. We are growing a lot of folks with the VA programs that are out there. Medicaid, of course, in Colorado, there's a lot of lobbying right now to increase the availability with Medicaid. Also, long-term care insurance. A lot of our clients, probably in 1999, 2% of our clients had long-term care insurance. Now, here at Home Helpers Denver, we probably about 20% of our clients have long-term care insurance. So that's something to be looking at. I'm 62, going to be 63 soon. I've not purchased long-term care insurance. It's something I'm thinking about right now. So, again, I'm real excited to be here today. I think we're gonna have some open floor, and I want to give Seth some time. I think what's exciting right now are the amazing folks that are helping folks age at home, the communities where folks move. There's never been better availability and communities out there. Home care, I think probably is the quickest growing. More and more folks are staying home. I think there's a national trend for less folks going into nursing homes. So above the care we give, I think another topic is probably technology. There are a lot of advancements, and maybe today we can talk about some of that.
Okay, that sounds good, Rick, and we'll circle back in a moment. So, Seth, you want to tell us more about BrightStar, please?
Yeah. First of all, obviously, thanks for having me. Thanks for covering a lot of good stuff already, Rick. I mean, you're exactly right. Not only is the senior population in America growing extremely quickly, and just the senior care industry as a whole growing extremely quickly, but on a local level, just within Denver and Colorado, the senior population is exploding. So, I mean, that's why, I mean, you said maybe there's around 200 agencies in town or around the area. I mean, maybe there's even more. I feel like anytime I'm out and about, even if I'm just driving, I'll see a new office for a company that I'd never heard of before. And everyone does things a little bit differently. Whether it's just kind of the corporate oversight with franchises, or I mean, you sometimes just get retired nurses or doctors that kind of pivot over to operating their own home care operation. But with BrightStar, we do non-skilled and skilled nursing. So we do that kind of lighter caregiving with doing errands, helping around the house, just companionship care. I mean, another big thing that I don't think previous generations really were aware of was just the loneliness epidemic with seniors. I mean, my dad is 74 years old. He lives by himself. I mean, I feel like I can only hang out with him so much. And sometimes it really makes a huge difference to have, caregivers come into the home. And I mean, even if it's just for a few hours or less, you're just watching TV, playing Mahjong. I know that's a huge hit in a lot of communities whenever I visit. But, one of the things with Bright Star is, you often start with that non-skilled nursing and caregiving, but we're all going one way, so health issues can come up. So I mean, it's great to either start with an agency that's mostly non-skilled and then pivot over to an agency, that maybe that non-skilled agency refers you over to get that skilled nursing. Or, you can just start with a company that, like Bright Star, where all of our caregivers are registered CNA, so certified nursing assistants. So, they can start with, kind of just building that rapport early on. Maybe you're just starting with those lighter things, and then as things progress, you've already got a relationship established with that person, with that company. So, that's something that we definitely strive for. We are also mostly private pay agency, as Rick mentioned with his company. We take VA benefits as well. Maybe Rick can speak to working with the VA a little bit better than I can. I mean, I know you're more on the operations side. I'm a little bit more out and about, but it just it is quite the beast. I'm sure you could speak to it, Rick. And I'm sure if anyone on here is a vet and you've had to set up your VA benefits and coordinate care and everything, it can be quite cumbersome. But especially our local VAs, there's a lot of good people out there that can help you with navigating those benefits. And there's a lot of nonprofits out there that can, help you figure out exactly what you're eligible for, what you can get paid for. And usually those companies are free to work with. So I'm sure AgeWise even has some resources in that regard as well. I don't know, Rick, if you want to maybe go over, VA benefits a little bit more as well.
Sure. Yeah, thanks, Seth. That's great. Seth, I was you in 1999. I was out there, that liaison out there, and God bless you. I love that you're doing it. And again, you're the generation that's going to be taking care of our generation or my generation. Yeah, I was just last week at a conference. Greg Beam, who's one of the kind of the head guys with the national a national group called Paradigm. He also goes to a lot of lobbying in Washington D.C. And so the way the program works, if we've got folks looking for information, there's kind of the side you heard about a few years ago was aid and attendance. That's kind of for anybody. It can be a surviving spouse or somebody that served during World War I all the way up, but they had to be wartime, and that benefits based on a lot of times income, need. I think right now the benefit, if you qualify, and again, if the income is lower and the needs more, I think it's up to like $1,800 a person a month, maybe 2,000, and those folks can use that for home care, for food, for rent. That also gets passed on to spouses, whether it's a male or a female. What they're talking about now, Seth, and everyone listening, is more the care support program. What I've learned, we just started. We got our contract last year, and we're just really getting it going. What it does mean is you've got to be getting your care through the VA system, whether it's a clinic or the main hospital here out in Aurora. Once your primary or case manager okays you to have services, it's not based on income, it's based on need. So with us, all of our caregivers are personal care attendants. We train for ADLs, and that's helping with the ambulation, bathing, showering, any hands-on, transferring, any kind of personal assistance. If they qualify for two of those or more through the VA system, they would qualify for the benefit if they get the referral. So we just started our first few VA clients. It's been great. It's a program I think that's going to be there, and both programs are going to be there for a long time. I don't care what side of the coin you fall on politically, everybody supports our veterans. So I'm real excited about it. As you know, Seth, here in Colorado, we have a lot of veterans and spouses of veterans. So that's kind of the two programs. I'd be glad to get some more. I have a couple handouts. I'd be glad to get to Barbara or Bob later that we could send out to the members if you'd like.
So Rick, a question on the VA thing, with the care support program. So how long did it take you to get things worked out with the VA so that you could actually provide that service?
So Paradigm is who we work for. They're kind of a billing, they do our billing, and they really helped us because as I was getting into it, it probably took about 6 weeks, Bob. And what they did is they worked along with Tri-West, which is the VA, and that we were able to get our contract. They really go towards agencies. And when I say agency, somebody is licensed under the Colorado Department of Health. You're going to be easier to qualify. Once you get that done, they'll give you it's a Medicare kind of number. It's called an MPI number. And once you get that, you're able to, start letting folks know you're taking care of the veterans.
Okay. So we had a question here directed to Brightstar, but I think this is for both of you, is the difference in the hourly rate between a medical skilled nursing person versus a what you called a personal care attendant. So what is the difference?
So Seth, I'll let you add to this because you guys kind of do both sides of that scenario. I just did a survey here in Metro Denver agency. I'm hearing and seeing everything from, and a lot of folks have like a 4-hour minimum shift. So I'm seeing everything from 42, believe it or not, Denver's kind of turning into San Francisco, 42 to 48 bucks an hour. Some of the agencies have a 4-hour, 5-hour per shift minimum. We do shorter shifts and we might charge just a little bit for that more. The medical side, because we work with Brightstar, actually, Seth, they're one of our companies we refer out when they need that nurse or CNA, that next level. What I hear is anything from 50 up to can be $100 an hour or even more for a nurse or maybe a medication setup. And we refer a lot of that to Seth here. I'll just mention you guys along with about 4 or 5 other companies that'll do those kinds of services.
Yeah, I mean, you're exactly right. And one of the things I was going to touch on is one of the advantages of using private pay. When, I mean, sometimes it can seem rather daunting to pay out of pocket. It is going to be a little more expensive, but just like you were saying, Rick, you often don't have to answer to those minimum shifts. I mean, Brightstar, we can even do an hour a week if you want to, because you're doing private pay. You don't have to answer to Medicaid or Medicare. Usually the turnaround time just to set up care, especially the non-skilled care, can be extremely quickly. I mean, within 24 hours, we can get someone out to you. So one of the advantages of private pay is, yeah, just being able to, especially if you're just starting with home care on that non-skilled level, have those shorter shifts and then to kind of work it up, as you have that rapport with that agency. But I mean, it's definitely a little different, even if you just go up to those northern suburbs. Their rates are a little bit cheaper. But I mean, there's just so many options down in Denver, and yeah, I mean, it's just the cost of living. So, obviously, the longer the shifts are, the cheaper per hour you're usually going to get. But like Rick said, you start getting some of the higher skilled nursing involved. that is going to increase the rates almost twofold. One of the things that kind of goes along the lines of Rick was mentioning technological advancements with senior care is medication management. I mean, we've got these we call it our advanced medication management program, where our one of our registered nurse care managers will come set up this box that has all of your medications laid out for, I believe, up to 3 weeks. And then it sounds off with lights and noises and everything when it's time to take your medication. Slot opens up when it was locked before. Take your medication out, you take your medicine. If you do not take your medication out, our nurse is made aware of that, and then we'll call you right away just to make sure that you're okay and what's going on with you taking your medication or not. And then that's also leads to other visits too, just to make sure that you're doing well with your medications, communicating with your PCP and your pharmacy, making sure that that's all set up properly. So that's usually going to cost a little bit more as well. Some of the things that skilled nursing entails and things that you can do at home are wound care, the medication management, IV therapies. We've got a nurse care manager on staff who specializes in that, so she can come in the home and help you with your IV medications. Things like tube feeding, respiratory care, injections, things like that. Brightstar, we don't do physical therapy or occupational therapy in-house, but we partner with companies that do. I do know that there are some home care agencies that have their own PT and OT. So, I mean, that's more common than not, I feel like, to have that done in the home. Same thing with speech therapy. I mean, and, going back to just why home care, instead of going to a doctor, hospital, or a physical therapist's office is, besides just being convenient, it's safer. I mean, obviously, sometimes it's easy to say COVID times are over. They're not. It's still a very real risk, especially for our seniors and higher risk folks with immuno issues. But the more you stay in your home, the safer you're going to be from infections. I mean, even going to a rehab facility or hospital, you never know what you're going to pick up. So, that's definitely one of the advantages of staying at home and having some of this higher level stuff taken care of.
Okay. So I had a question. You both mentioned Medicare, Medicaid. So talk a little bit more, either of you, about how Medicaid helps with paying for in-home care, and how much Medicare actually provides in terms of payment for in-home care.
I mean, Rick, you might have to talk to that. You're more on the operations side of things, and you're probably looking more at billing statements, and especially because with Brightstar, we don't take Medicaid or Medicare. I mean, it helps a huge amount. We get people that call in all the time, looking to work with us, but they want to use Medicaid or Medicare. We always play nice with other agencies, and like Rick was saying, refer out to other companies that can take care of them, companies that we trust, companies that have a good reputation. And you can also sometimes pair some of that care that is paid by Medicaid or Medicare with other care that's being paid for, with private pay, with long-term care insurance, with VA benefits. You can always kind of mix and match. I mean, usually it's kind of daunting to, figure all of that out, but it's very doable, and it can definitely, help you save a lot of money. But Rick, I don't know if you want to maybe talk a little bit more about the specifics of that.
Sure. Boy, there's so much happening right now and changing. Bottom line, folks want to stay in place. I just read an article and these are kind of 2 or 3 or 4 of the reasons people want to stay in place. They want to be independent. control the space that they've always controlled. They're more confident at home. They prefer a quiet home environment, one that they've, I always tell people they've raised their kids in or maybe retired to. And you brought up safety. That's most Americans that are elderly or older adults, they feel safer in the home they've known for years. So this is what's exciting about, we'll talk more about technology here in a few minutes. Medicare, Medicaid, Medicare, pardon me, basically covers or traditionally covers physical therapy, speech therapy, occupational therapy, maybe a nurse's visit, which usually following an episode, or they call it an episode. So you maybe have been in the hospital. It used to be, and I think it's still 3 days, 3 midnights, are what I tell clients. Once you've had that visit and you've had a prescription written for PT, OT, and speech, you can go to rehab or you can go home with that. It's traditionally, again, 99 days a year or 21 days per occurrence or episode. What I've noticed lately, the trend, because we're trying to get folks from the hospital to rehab home. Maybe home care comes in and physical therapy follows them. I've seen the trend. It's typically 10 to 14 days someone's at a rehab. Again, Medicare pays for all of it if you're 65 and older and registered. Medicaid, state by state. Colorado's making some headway. Okay, so here's the exciting thing. In the past, the reimbursement for caregivers has been lower than what Colorado charges for minimum wage right now. So there are companies that do it and do Medicaid. Hopefully that rate keeps going up. Other states, I'm seeing a trend. I'm hearing, a trend to reimburse and make an agency where they can do Medicaid. So hopefully we see that in Colorado. Bob, I know Bob's been around with some of the lobbying going around and probably knows more about that than I do right now. But again, Medicaid state by state. There's some great agencies. Seth, I refer out to you guys for med setups and infusion and stuff. I do refer to 3 or 4 companies for Medicaid. Shirley Prop, I see you on here. Shout out to you. Great to see you. So that's kind of the difference with Medicare, Medicaid. I will tell you, Colorado is making headway again, and it's people like Bob, AgeWise Colorado, some of the coalition groups that are really out there talking to our senators and Congress people.
But in the meantime, Medicaid rates remain too low.
Yeah, Bob, I'm going to tell you, I think the reimbursement now it's gone up. It was in the $18, $19. I think now it's in the low 20s. So if you think about an agency that's employing a caregiver and they're paying, I think minimum wage in Denver County is $18.29 now, and they're paying caregivers more than that, it's hard for some agencies to tap into Medicaid. We need to really be out there fighting for the benefit. By the time you paid FICA and taxes and all that, an $18, $19 caregiver for an agency, you're in the 20s. So again, Bob, I need to join you on the streets and get out there and do some lobbying.
We had a question. I hate to jump around too much here, but I think we've talked a lot about what does Medicare cover. Basically, it's out of the hospital and into the home, and they'll cover it for X number of days, and then that's it. And then Medicaid, if you're willing, if a in-home care agency is willing to take on Medicaid rates, then yes, but most are not because they're far too low. And I think I've heard in the past from you, Rick, that even VA at one time was too low, but they've increased their rates pretty significantly to allow for better in-home care for veterans, which is a great thing to see. The tech piece, well, let me stop there for just a second, because we had a question from a person about VA, and the question was, what's the best place to start, and is it at the VA hospital? So can you speak to that, Rick?
I sure can. Yes, it's at the VA hospital, it's at least for the care support program. That program you have to go, and I go to the VA, by the way, and I'm a third generation veteran from my grandfather, my dad, then me. So you need to be going to the VA for your care. Once you're in that system and you meet with your primary, you're there. They're going to talk about the need of ADLs. Again, it's those personal care uh, options that really qualify you for that. As far as aid and support, there is a clinic. You can go to the VA and they have I would ask for care support or maybe their client services, and they can walk you through qualifying for aid and attendance. Aid and attendance, it's about I don't want to scare anyone, it's probably about a 25, 30 page document. You're going to need your DD 214, which when I retired out of the Air Force, that's that form you get. That's the first thing they're going to ask for. And what I've heard, it's gotten quicker. So once you get that paperwork going, I think qualifying for aid and attendance can be as quick as a month. Again, going to see a primary at the VA. So if you're using Medicare or your insurance to go to a private doctor, you can do both. I've heard folks do it. So you're just going to need to also get that visit over at the VA hospital here in Aurora.
Okay, thank you.
You're welcome.
And I want to ask another question back on the long-term care insurance too. Do the long-term care insurance policies, do they cap the amount that you'll pay, that they will pay? And I think different policies probably work differently in that regard, but I don't recall a cap on the hourly rate, but more of a cap on how much they'll pay out per month. Does that sound correct?
Yeah. Seth, do you want to address that a little or?
I mean, once again, you're probably looking more at billing and payments, but yeah, it is more so limits on the volume of care and the rates of care. I think each policy is different. Obviously, I've had or heard, just from folks that sometimes it really depends on the company and your policies. Sometimes people are raving about their policies. Other people think, oh, this is maybe a waste. They're almost getting priced out of their premiums. I mean, Rick, you were just talking about how you're kind of in that phase where you maybe want to get a policy going yourself. I mean, obviously it's never too early, so I should be thinking about it as well. But I haven't exactly done much shopping, but I don't know if you have any other insight on that.
Yeah, I do. I didn't want to take too much of the time up.
No, you're
So
good.
we do about 20%. I've got a full-time manager who that's what Janine works on is a long-term care. So Bob, you're right. Every policy is different. Uh, what I would look for if you're shopping is something that's going to give you those 3 visits a week or up to 40 hours. Back in the late 90s, GE, which is now Genworth, was probably the biggest company and probably New York Life. And I'll be honest, they were writing policies. They were either really great where people could get full in-home care. And again, they base that on every one of them's 2 ADLs. So it's got to be sometime in that home visits, the bathing, the transferring, the walking assistance, anything personal care. And so what I'm seeing now in the newer policies, I'm seeing pretty good policies. It could be what I noticed the last 4 or 5, they've had a daily cap, so it might say $200 a day. Or I've seen a few that are higher than that because we do all the way up to live-in care. So you can only imagine having somebody in your home 24 hours a day. So the best policies I've seen, they cover maybe up to $500 a day. So I would look at the company you're going to call. They're going to look at if you have any of the 5 horsemen, cancer, heart disease, as far as qualification. But the other thing to look at with long-term care, there's an item called elimination period. I hate the name. It's been called that for 25 years, and you'll see a lot of 20 days. I've seen 0 days. I've seen 99, 100 days. What that is until you have that many days of service, you're going to pay out of pocket. Uh, so we'll chart that, and every month we collect that data, get that to the long-term care insurance company. And then usually once we start the initial, then the family would get a reimbursement check for whatever daily limit their policy says. So that's kind of how long-term care insurance work. Again, it's based on those ADLs. I think it's a great product. Earlier, Bob, I was thinking, even folks that have a lot of private funds live on a budget. So what I've noticed, whether you don't have a lot of money or you've really planned for retirement, we're all on a budget. So folks are looking at long-term care insurance. They're looking at where Medicaid is going to change. I think a lot of baby boomers like me, I think there'll be more of a spin down. And my guess is Medicaid uh, for a lot of folks will be an option for home care that probably more of America will look at in the next 20 years. My dad, I tried to get him to look at that, but he was a proud Army man and he had worked hard for his, the home he owned and everything. It was a different generation, but that's another thing that's kind of changing right now is kind of just the culture of home care.
Yes. And I know some of the long-term care insurance companies are not even selling their policies at the moment because they kind of messed up on their underwriting a long time ago, and it caused them to take pretty
Yeah.
significant losses on some of
I,
their
I
policies.
I agree with you, Bobby. I will tell you, I guess I can put this on the webinar. The ones I'm seeing with my clients are New York Life. I still have some of them bank, um, um, Genworth, trying to think of a couple of the other ones. Those are probably the top two. But I will tell you, we ask every client now, and I'm amazed how many people have a policy. It's not something you're when you come out of the hospital, you're just gonna start it for 3 weeks. Long-term care insurance is meant for the day that you're gonna have ongoing long-term care. That's really how they're designed. They will come out and visit with you or family, you and your mom, and they will make sure she qualifies for ADL. So I've had clients that fully qualify, and I've even gone out to the home the day they're meeting with a representative, and all of a sudden somebody that hasn't really been able to take care of themselves, they're sitting in a cashmere jacket. They're looking good, and unfortunately I've seen them denied. They really, it's insurance, so they want to make sure the need is truly there, that it's an honest need. And so, again, I would look into long-term care insurance. So,
Yeah, thank you. And I also know one last comment about that is that I know the long-term care insurance companies are focusing a lot more on providing preventative services so that you don't actually need to activate the insurance policy. So, yeah. So we had a question about activities of daily living, and I know there's like half a dozen of them or so. Can you just rattle off what those are again, please? The activities of daily living that qualify for any of these benefits.
That's quite the pop quiz. Maybe Rick and I can collaborate here. But I mean, it's eating, bathing, dressing, toileting, transferring. So, from seated to lying down to seated, standing, etc. And then walking or moving around. I don't know. Do you have some other ones there, Rick, that you can cap
no,
off
those
that
are the
list?
those are the key.
Yeah.
Those are the key 5, 6 of them, and there's different levels. So it can be that we're doing full assist with the client that needs that. It could be that it's just safety, standby assist, and a lot of the insurance companies will take that, or Medicaid or the VA even. So it's, we all have a different level. We want to be independent. Well, the biggest thing I hear come up with our family is safety and ADLs. That's the part right now. The thing I'm reading for seniors, one thing we need to call, and I'm again I'm heading there myself, gripping feet. A senior that works on those safety techniques or goes through PT or even maybe works out at the gym, the ones that address that the earlier they can are the ones that when they go to fall, instead of having to fall and breaking something, we're able to recuperate and not have a bad fall. So it's ADLs are the thing to watch for. I would say if you're looking it changes in your mom and dad. Those are things I would definitely watch for with dementia, the cognitive. I want to go back to that too. A lot of the long-term care policies will trump the ADLs if mom or dad's had a diagnosis of Alzheimer's or Lewy bodies, any of the dementias. Parkinson's is the big one right now. If that diagnosis has been made, a lot of times the policies that takes seat number one, and it doesn't even matter about the ADLs.
Yeah, and to add on to that, I mean, just the importance. I mean, we could have like a whole. Maybe you've already had a webinar on fall prevention, just how important that is. I mean, we part of our orientation and onboarding process for our CNAs that we hire is you have to pass a transferring test because of just how important that is to be able to. And I mean, we have small little women CNAs that are like 5 feet, 90 pounds soaking wet, and they're trained and know exactly how to leverage themselves to be able to pick up, or help transfer people of all kinds of different weights and shapes and abilities. And I mean, all it takes is one fall for someone to go from being very independent and sharp to just going downhill extremely quickly. And suddenly you're in hospice care. Not to be doom and gloom and scary, but that is just probably the biggest ADL that we prioritize. And I'm sure Rick, it's the exact same for you guys.
The other thing that has come up on this issue of falls is, and I've just heard this recently, is that the number one call that fire departments get just to pick somebody up after they've fallen in their home.
Yep.
It's not fighting fires or dealing with automobile accidents. It's falls in the home. And they spend a lot of their time and resources doing that.
Yeah. And a lot of people, when they are first setting up, their home care, especially if, it's a family member, son, daughter, something like that, they're setting up home care really just to have someone around in case mom or dad falls. Just to have someone there to get on the phone as soon as possible, or to even, just see it before it happens. Dad's looking a little wobbly today, when previously he wasn't. That goes into the care notes, and then, you're keeping an eye on that, and can maybe even start getting some, PT going sooner than later.
Yeah, Bob, that's great. You mentioned our first responders because, that is often where the first call when we get a family, they've already had that happening. And I love it because I live in central Denver, and there's 3 or 4 houses very close to where I live even. And Bob, you're right. That is the number one call they get. But a lot of times that's the alert call for the family to call us. Again, it's a village. It takes all of us, the village, to make home care work. We partner with agencies like Bright Star, but our biggest partners here are working directly with the hospitals, the rehabs, and then hospice and home care. I mean, I'm hearing more people not say hospice. What we're referring to is home health care and hospice. And so a lot of times palliative, getting a family, they build that trust with you as a son or daughter, and then maybe we come in as an agency, and then we can actually add those Medicare things. Hospice, home health, a lot of times it's all covered by Medicare. So again, it's that education, and meetings like this today are important so we can gain as much education in this quickly growing culture. I will say Colorado, we're one of the better states that I feel is embracing what's about to come, this great tsunami.
Yeah. So thank you for that, Rick. And so we've had some questions about the territory that you cover. So I'll start with you, Seth. So and I know each Bright Star is its own franchise operation. So you each have your own geographic territory. So what is your territory?
So our office is called the Central Denver location. So Bright Star Care of Central Denver. It is everything south of I-70 all the way down to Castle Rock. And then, so within that area is where, you're going to get care very quickly. It's going to be very easy to get that set up. Rates are going to be, just our base rates. The no minimum policy that we have. So, having those short shifts for, an hour or two a day or per week even. Then we, east to west, we get a little fringy, where, rates might be a little bit different. We're going to need to maybe have longer shifts, just to, keep in mind just the quality of life and the sanity of our caregivers and our CNAs. Obviously, we all know just how difficult navigating traffic in Denver can be sometimes, especially if weather's involved. So, on the fringes to the east is Watkins, kind of that area, maybe even Elizabeth down to the south. And then to the west is going to be, Evergreen, Conifer, that's kind of on the fringes there. And if you have someone that's living on those fringe areas, that's usually when we can, partner up with other agencies. Let's get this staffed. Let's get this taken care of. We never want to have someone call that's living in Evergreen, and we're not going to just, turn you away or say, hey, this is going to take a while. We'll do anything that we can to make sure, even if it's not us that's going to take care of you at all, we're going to make sure that you're getting taken care of by somebody ASAP. We're going to treat you like you are one of our clients. But even if we aren't going to eventually take care of you for sure. So that's our service area. And it's really, there's really no set minimum time. There's really no set rate for those fringe areas. It's, arbitrary. We discussed it. It just really depends on the case. And whether we do need to bring in other agencies or other healthcare companies to help take care of your needs.
Okay, thank you. Rick?
Kind of so I cover everything from Broomfield down to Castle Pines, Castle Pines. And then we're all the way a little bit past Aurora east and up into the mountains, Evergreen, Genesee, Morrison along the foothills. That being said, we partner. I have 5 other offices, and we work with the VA program private, and we also have an office up in Fort Collins. That's Kate, Steve, and Kat have Boulder. Longmont is Jared, and then we have Lori in Castle Rock, and she does all the way down to Colorado Springs where Russell is. So we refer within our own organization, but also it's a village. So I've gotten to know a lot of wonderful people making a difference in people's lives. And we refer out to many of the other agencies. During COVID, that was a horrific time, and we all got through it together, and we were referring to each other. If I didn't have a caregiver, I'd call Brightstar, I'd call Home Instead, or one of the other agencies. And I think that changed during that. I think it changed the culture nationally for all of us to work as a closer village. So anyway, we've got like I said, we have a very large area. I have about 150 employees, caregivers, personal care attendants all over. So it's a real treat watching my staff make the dots connect. And so that's pretty much it on our area.
Yeah, and I guess I forgot to mention our other locations as well. We have an office. It's kind of a dual office. They've got the physical offices in Broomfield and Greeley, but they work as one location to take care of everything north of I-70 up into Wyoming, where there's definitely a big home care need. And they've been growing into the Wyoming market pretty quickly recently. And then there's a location down in Colorado Springs, so they'll take care of everything south of Castle Rock. And then we have a newer location. It might only be a couple years old, out in Grand Junction. And they take care of a lot of that western slope area. Pretty expansive.
I think I'm wondering now about the more rural areas of Colorado. You know, that you neither one of you cover those, obviously, but it seems like there might be a little bit of a shortage of in-home care providers in the real rural and the frontier areas of Colorado, which are pretty sparsely populated.
Yeah, absolutely. And especially, and if you're talking about, in the mountains, I mean, that's just an issue of people being able to get around, people, wanting to get up there. I know Mount Evans, they're based in Evergreen. They take care of a lot of that area doing home care and hospice care. They're a great company. So yeah, we partner with them a lot when, we're not able to get anyone up in Evergreen. But I mean, the deeper you go, the harder it's going to be. And I mean, sometimes it really is just, you get a snowstorm up there and, even though you've got, caregivers that are scheduled to be there, I mean, it's almost impossible. They close the roads. It's not easy to age in place in certain locations compared to down in Denver.
Probably the number from discharge planners, folks that call me from the VA, hospitals that call and they need care out in the rural frontier up in the mountains. The number one resource I hear them kind of say positive things about is care.com, because they have private caregivers all over Colorado that are vetted. They have done background checks on all the folks. So I would probably say get on and look at care.com. You're welcome to call me. I get on and I get on the internet and I find, like Seth was mentioning, any company that's working up in Aspen or out in Watkins. My number, if you want it, 720-854-5876. I'm fine if you call me. That's my personal number. And we'll just get on the Google. That's what everyone's saying these days. And we'll find care. But that's that village. And so Seth, I can tell you have the same ethics. Let's help our folks find whatever great care is out there. And
Yeah.
sometimes it is a private caregiver.
We have about 5 minutes left here, so I'd like to get back real quickly to a topic called, technology related to aging. So, Rick, I know you've done some work on this, and Seth mentioned a little bit about the medication management piece earlier. So, Rick, can you talk a little bit more about age tech in
Yeah.
general? And
Well, with the this is the hot topic. We actually have a director of technology, and I've served on a couple of the pilot groups. So things you're going to see happening right now: medication, dispensers, alerts on those, sensors showing patterns for our folks. Maybe I love privacy of mom and dad, so these might be sensors that just show patterns. Are they getting up and going to the restroom during the night? Is there movement? Smart home technology, cameras. Again, we get into some privacy stuff. Healthcare monitoring, robotics. Believe it or not, that's going to be a biggie. We're all going to see that. Uh, Talked to family last week. They wanted just to be able to find a sensor where they could help mom change the thermostat and lighting. Fall risk, most of the falls happen. A lot of times it's because of lighting. So are we able to go into some type of system and monitor the lighting at night? Is mom using a bedside light, or dad? So remote monitoring is going to be a biggie for us kids. What I'm seeing too, they talked about at conference, are not just smartphones, smart TVs. So where mom can look into the TV and say, I want to talk to Seth, and Seth comes on. And I think that's going to be a big outreach that we're going to see. So technology, with caregiver shortages coming down, and we're going to have our senior population, going up drastically, we need to embrace technology. So whether it's a family member, working with a private caregiver, an agency like one of ours, it's going to take the village. And so that's kind of what came up in our last week in our technology part of the conference. I know, Bob, you've worked with and kind of alongside some folks that are embracing that right now also in Colorado.
It's a hot topic for sure.
Yeah, absolutely.
And a lot of new technology companies are being born. It seems like every week, to focus on this whole older adult marketplace.
Yeah.
But how they look at it. So because it's growing so fast, and as you said, the number of available in-person caregivers is not keeping up with the rate of change, and probably never will. So you have to start augmenting it with other options. Seth, do you want to add anything to that before we go?
Yeah, I think just in general, assistive mobility devices, that technology is, definitely progressing. And I think most importantly, um, the coverage of those kinds of devices by private insurance or Medicaid, Medicare, VA benefits, all of that, that is growing as well, just to make that stuff more accessible for folks. Going to like trade shows and things where they exhibit, different things to get mom out of bed, or, to help her with the toilet. The technology is amazing, and it didn't seem even pretty recently like that could be something that you could easily have in the home. That's something like you could only have in an assisted living community. So that's definitely helping with people being able to age in place, and then pairing that just with that private home care.
So, Audrey, I noticed you kind of dropped off for a few minutes, and that's about the time we answered your question about how to start with VA. So, and the answer to that was start with the VA hospital, by the way. So, and then go on.
Got you in there. Yeah, and if you get again, if you need any help with that, call me. I'm starting to get to know the case managers and figure out the VA system. It is its own tiger. But again, being a veteran myself, I'm excited. Bob, you mentioned the reimbursement, and they are really doing well with Colorado to help us afford. We're a fair wage state. I totally support it, but caregivers now and agencies are making 1850 up to 25, maybe even $30 an hour. So being able to embrace these programs, get Medicaid where it will help us with that, it's a high priority. We're pretty quick here in the next 10 years. Our elder care population is going to be bigger than our younger population. So again, it's a lot of education, working with folks like you, Bob, with AgeWise coalition groups here in Colorado. I can't stress. Bob got involved with this a few years ago, and I knew Bob then, and I run an agency, and I've kind of gotten away from being as involved politically as I can. But as I head towards my retirement years, you're going to see me out there fighting for us.
Well, we need that. And to close on what that comment you just made, in 2020, the number of people over age 60 in Colorado exceeded the number of people under 18 for the first time. And if you look at a graph of that chart of that, it'll show that the over 60 population is moving in an upward direction, and the under 18 is kind of flat. And that's out into 2050 and even 2060. So we have there's a lot of growth, and it's not just in Colorado, it's all across the world, actually.
Yeah.
The highest aging country in the world right now is South Korea, followed by Japan, and then some of the European countries, and as well as the United States. So it's a worldwide issue, and so there are a lot of people focused on it to figure out what do we need to do and how can we do it. So thank you for what you folks are doing to help the cause, and we appreciate very much everybody being here today. This recording will get posted probably within the next few days on our website and on our YouTube channel. We encourage people to subscribe to the YouTube channel as well. I think we have about 25 subscribers right now. And And then, as I said earlier, this particular webinar will be transcribed as well, and that will be on our site too. So thanks everybody once again. Have a great rest of your day, and we'll see you next time. Okay, take care. Bye-bye.
Thanks.
Thanks, everyone.